All right, hello. So I'm Logan Reeder, and this is my presentation about my winter 2020 internship that we half completed, but we didn't quite complete. So to begin, I did my internship at Oakland Orthopedic Appliances in Bay City, Michigan. My site supervisor there was Corey Smith, and I was there with one other student at the time, and we pretty much went the entire time during our internship. We started right away, and we went up until we couldn't go anymore. So my plan after Saginaw Valley, my plan after this is my final semester at Saginaw Valley. So I plan to go to CMU to continue on to graduate school. And I've been accepted into the class of 2023 for the DPT program. I've just been told that we won't actually begin there on campus at first, but we will be beginning online in May. So I'm excited for that to begin in May. And so that kind of goes into my reason for choosing this site. It's when I go into PT eventually, when I graduate from everything, I really think it would be awesome if I could work with the amputee and prosthetic community. So by choosing this internship site, it was a really good way for me to be exposed to the language of the field, because there's some different terms that people use. It's instead of saying something like, say, a stump or the limb you got cut off, it's very appropriate and it's expected for you to say residual limb in any sort of proper documentation. Those are things you really don't know unless you've been in that environment, unless you have been exposed to that kind of field in general. And on top of just the language, there's a lot of tools that they use. Prosthetists are very adept at using Allen wrenches for anything and everything, as well as just using just kind of basic things, such as using hand sanitizer for some lubrication when putting on a prosthesis, and just little tips like that, that again, you can't really get outside of this field. So I really thought it would be good for me to help prep for that in the future. On top of that, while I was there at Oakland specifically, they not only do prosthetics, but they also do orthotics. So it was a good way to get exposed to that sort of field as well. So here's the facility. On my left-hand side is the office. That top picture is their track area that they just newly built. It has a harness system overhead that allows people to walk without the fear of falling, which is very beneficial. And the other picture is just kind of their waiting room and some office rooms, things like that. On the other side there is the lab. The top two pictures are the orthotic side of the lab. So that's where they make the ankle foot orthoses, the shoe inserts, any sort of like ankle braces, those are typically made in that side of the lab. And the bottom half there is the prosthetic side. So that's where you see all of the sockets made, as well as putting together all the pieces with the pylons and the knees and the possible ankle joints and all of that. So my duties in the office were really, the main thing was to just be there and observing the practitioner that I was with. Although Corey was my site supervisor, I was still able to go around with different practitioners depending on how busy Corey was or how busy they were, or possibly if another practitioner had something really cool that was really unique, he would say, okay, go over there and see what's going on over there. And so we would go over there. And so it gave us a wide variety of things. One of the big things that I needed to help out with was prepping the materials for casting. Every time somebody gets a new socket for their residual limb, it's important to cast them to make sure that it's accurate so that it fits their legs so that it's comfortable for them. And so there's some materials that go into that, as well as prepping the harness and materials for walking. Because while to you and me, walking may seem like an easy everyday thing, for someone with a prosthesis, it can be a very daunting task, and there's a lot of prep work that goes into that to make sure that they are safe throughout that. Anytime the practitioner needed help with an adjustment, whether that be smoothing down an edge on a socket or maybe tightening a screw or going to get something else, the little things that I was able to do that I knew how to do, I was able to assist the practitioners with those, as well as just resetting the rooms and equipment, cleaning things, making sure everything's back where they went to get ready for the next patient that was coming in. So as far as prosthetics, there's a wide range of prosthetics, whether that be for the above knee and below knee amputations. Those are often the most common ones that we think of when we think of prosthetics. But there's also upper extremity ones for your hand, for your fingers, for your arm, anywhere from the shoulder to the elbow, anywhere along those lines. as well as, although above knee and below knee are the common lower extremity amputations that we find, there's also a hip, basically a hip amputation that can happen as well, that we were able to see one of those. Most of the prosthetics at Oakland are all custom fitted. So we take the cast, then we take it to the lab, we fill the cast, we we fill the mold, and then we make the socket and everything right on site, and then it's customized for that person. There's no one size fits all as far as prosthetics go. There's a wide variety of patients there for many different reasons and at many different levels of their treatment process. Some people had a very recent amputation. Some people, they've had an amputation for 25 years. It really just depends on the patient and depends on how receptive they are to the training that they receive, how good of a patient they may be. When it comes to amputees, unfortunately, there's a lot of comorbidities that may be present that can add to the complexity of the situation. Oftentimes, diabetes and lymphedema are two very widespread comorbidities that can happen and can complicate things, can make the healing process go slower, can make it maybe not even happen at all. So those are things to consider when developing these prostheses, as well as the possibility of trauma. Some people are a perfectly healthy individual and they may have just been at the wrong place at the wrong time, and they had their limb amputated without their choosing by another entity. So maybe that's a car accident, where there's some train accidents that happen. Anything you can think of is the possibility of a trauma that may cause an amputation, unfortunately. So on the other side, orthotics. Orthotics are very common. However, people don't really label them as orthotics, so it's kind of hard to know exactly what this term means. The most common, I think, are shoe implants. So that's like the Dr. Scholl's commercials that you can see all the time. Those are shoe implants, and that's kind of the same thing, only these ones are more geared toward foam and molding the foam in such a way that adds support to your foot. There's also braces for scoliosis, as well as the foot, ankle, and knee deformities, whether that be a drop foot is a very common ailment that can be fixed with an orthosis, or really anything that you can see. Kids are really common to have orthotics. That's going to be in the next slide. As well as helmets can be made for any sort of head deformities. So whether that be a flat spot or a pointy spot or anything that's really not what we want to see in an infant's head, the helmets, as you can see in the bottom picture there, can be made to help support that and help the growing process. As I was getting into the types of patients, many of them are kids. This is where you see kind of the most deformities, and it's important to catch these early so that when they grow up, when they grow into adults, they can live as close to a normal life as possible, and hopefully those deformities have gone away or they've grown out of them in some way. However, it's really possible for anyone to need one. Whereas kids are the majority, there's still a lot of people, there's still a lot of adults that require something, especially for any sort of foot drop or any sort of knee injury after a knee replacement that possibly they need a brace. Anything along those lines is possibility, is grounds for an orthotic. Again, shoe inserts are widely recommended. They can add to comfort, they can add to your foot health, they can help prevent certain ailments of the foot and ankle to make sure you can stay away from those. However, the helmets are going to be exclusively for infants because infants are the only humans that have any sort of really moldability in their skull. Once they get to a certain point in their life, and especially adults, your skull is not really going anywhere. It's pretty set in stone of what it looks like and where it is. So that's why helmets are really only used on the infants. So Oakland has developed a walking program. They've found that oftentimes insurance doesn't really let physical therapists get out the amount of care that they'd like to. So they've started this program that uses a harness and a prosthetist hand in hand to help people who have finished up their physical therapy process to get back to walking and learn more about how to walk. And they've been keeping track of the performance of their patients, and they've been seeing a lot of improvement. So that's really cool that they're able to do this and provide this service to the rest of the community. They've also started an amputee support group. They've realized that it's hard to go through something like this alone. It's a really big life-changing event. And they really it's really just a good way to bring everyone together and to discuss different items. Some items that happen right before we were there, they talked about the correct liner to wear in certain situations. And while we were there in that top picture, that's a picture of them going through what it might look like for an amputee to have a self-defense course, because that's something that's not often thought about. If someone doesn't have their prosthesis, or if they're in a wheelchair perhaps, it's kind of hard to defend yourself and you can really feel like you're vulnerable. So that's a good way for amputees to kind of feel better about their situation. As far as the lab goes, they fabricate most of the products, especially on the prosthetic side of things. However, they do work on prosthetics and orthotics, and everything, as I said before, is a custom product. Everything is made to the patient. As far as while I was in the lab, we kind of had split duties depending on where there was the most work. We went to that side. There's a wide range of things that could happen. We did a lot of cleaning while we were there, as well as my friend that I was with, as well as I got a chance to make our own AFO for each other, and we made shoe inserts for ourselves. And those are what those pictures are there. The white thing is AFO, the black things are the shoe inserts. As far as advice for future students, I strongly recommend getting involved in the SESA and the pre-PT for Me program. Those are excellent ways to get networked and to get an idea of where you want to go to school. Lab time is also very important, working with Keisha to get in the lab and do bod pod, to get sports testing, any of that. Stay in contact with your professors. That's always very important. And contact a grad school rep early to make sure that your name is kind of in the back of their mind and is on their thoughts. So with that, that has been my presentation on Oakland Orthopedic Appliances. I'm Logan Reeder. Thank you.